Thank you, Lisa. Hi everyone, it's lovely to be here today. Thank you very much for having me. So as Lisa said, I'm one of the specialist pharmacists here in St. Mark's. So obviously I'm a pharmacist. I'm going to be talking about medication to you. Oh no, too far. Bit overly sensitive. Okay, so I'm going to talk to you today about drugs that reduce your bowel frequency and quantity, the treatments of pouchitis, side effects to medications that are quite generalistic and may or may not affect you, safety of medication in pregnancy and breastfeeding, prescription charges, and then any questions that you may have at the end. So the drugs which we commonly use for pouches are for two main reasons. One of them is to reduce the bowel frequency and the other is for pouchitis. So to reduce bowel frequency, there are common drugs that we use like loperamide and codeine. Hands up any of you who have ever heard of these or are taking any of these. Oh great, fantastic. So you can tell me a bit about them then. Pouchitis. Different things that we use. Main one is antibiotics, probiotics, which Evie touched on already, and other treatments. So we're just going to go through each of those individually. So we'll start with the loperamide and the codeine that you all seem to know lots about, which is really good. So it acts on the gut receptors, and if you imagine your gut is basically contracting really, really fast as the food moves through the stomach. What the loperamide and the codeine do is it reduces the frequency of the contractions, therefore allowing a larger contact time of the food with the intestine. Therefore, you're getting maximum absorption of the food or the drink that you're having. Loperamide is generally used at doses of up to about 16 milligrams 4 times a day. And it's more favourable than codeine because codeine can make you feel quite drowsy, where loperamide doesn't. There are different formulations that are available: tablets, capsules, loperamide melts, liquids, and there are some variations and patient preferences for those. With regards to codeine, it can be used up to about 60 milligrams 4 times a day. And we tend not to exceed the maximum dose because it can make you feel quite drowsy and is not recommended due to the other side effects. In order to maximise the benefit of the medications, we would recommend to take it 30 minutes to an hour before food. So that basically means that it's working in the system at its maximum ability. So when you put a sandwich or a drink into your mouth, you know that the maximum absorption will be occurring because you've taken your loperamide and codeine at the right time. And then I've just put a few side effects of each of the medications there. Some patients may get them, some patients may not. And you might find that as you increase your doses higher to the 16 milligrams of loperamide or the 60 milligrams of codeine, you start to see more of the side effects. So it is a bit of a balancing act. There is evidence to show that a combination of both the loperamide and the codeine work better together as well. Now, you may have noticed that on some of your pharmacy labels it says no more than 8 in 24 hours, which is a generic general warning label that's put onto the medications. Please be relieved that that does not affect any of you in this room. You are allowed to exceed the maximum dose. You are being seen by clinical specialists who are monitoring and reviewing you regularly, and those doses are appropriate for you to maintain your condition. However, there are some GPs that are still reluctant to prescribe some of the higher doses just due to the uncertainty of it. So treatment of pouchitis, the mainstay of treatment is antibiotics, and it's usually for a short course of about a couple of weeks. It can be used as longer courses over a couple of months, but there is antibiotic resistance in the community that we do need to be concerned about. Long courses of antibiotics lead to side effects and also resistance. You may even be using a combination of different antibiotics, one in order to prevent the resistance occurring, but two also to be able to maximise working on the different bugs that you might have grown. And it's really, really important to, one, take the antibiotics on a regular basis. So if it is twice a day, try and take it 12 hours apart, and to complete the whole course. A lot of people find that after day 4 of taking the antibiotics, I feel fantastic now, I don't want to continue taking it, and they just stop. What generally happens is that your antibiotic level is reached its maximum, so that's why you feel fantastic and back to normal again. Your bacterial level is at its lowest. When you stop taking the antibiotics, all that happens is that your antibiotic level goes down and your bacteria grow up again. And that's what we don't want. That's what will cause resistance, and that's what will cause the infection to come back again. So really important to complete the whole course. So I've just put a couple of the side effects of some of the main antibiotics that you would be treated with if you were to have pouchitis. So metronidazole is quite a metallic-y tasting antibiotic. It tastes like you're sucking on coins. It's really not very nice. Also, you have to avoid alcohol with it, and that's during the course and for 48 hours after completing it. You basically get this really drunken, groggy feeling all the time, and it's really not nice. And in really high doses, again, can cause weakness, pains and cramps. Ciprofloxacin, generally avoid sunlight, wear appropriate sunscreen because it does make your skin a lot more sensitive. Arthropathy, which for under 18s, which is basically inflammation of the joints, and tendinitis in more older patients, which is basically inflammation of their tendons. Avoid taking iron, calcium and dairy products around the same time as it. So we usually say about 30 minutes. Coamoxiclav, it's a penicillin-based antibiotic. So obviously if you have got a penicillin allergy, do inform your doctors of that. It's really important to know the nature of the allergy as well. So often patients will say, oh, when I was 5 I had an allergy to penicillin, so I've never had it since. But actually on a little bit of digging, you find that it was just a little bit of nausea and vomiting, which is just common side effects of any antibiotic really. So trying to distinguish the nature of the allergy is significantly important to the decision that we would make in terms of which antibiotic we can give you. By cutting out the penicillin antibiotics, we're cutting out a huge chunk of potential antibiotics that may be really beneficial and work for you. So just try and be as clear as you possibly can with the information that you give them about the type of allergy that you've had. And it can cause liver problems in more older patients of about over 60 in male, and they tend to be due to longer courses of the antibiotic as well. Probiotics, which Evie's already touched on, so I'm not going to mention this too much. VSL3, it's in 8 different strains of bacteria and is useful to maintain remission for patients who have chronic pouchitis, and it's also a suitable alternative for those patients who are needing long-term antibiotic treatment and therefore could build up a resistance to antibiotic treatment, and those can be purchased from pharmacies and health food stores. They're not available on the NHS at the moment. Pregnancy and breastfeeding. I'm just going to touch on this slightly because it is quite an interesting group of patients, and there are often a lot of questions about what medicines can I have if I'm pregnant, and will it affect the baby, will it affect the breastfeeding mother? So there is limited data on obviously this group of patients for ethical and human rights issues. We don't test people who are pregnant and people that are mothers that are breastfeeding and young babies. It's not really norm. So what we do is we extrapolate animal data. So we look at animals that have very similar systems to a human in terms of their metabolism, their enzyme levels, And funnily enough, the majority of the animals that have the closest human system to us are the rats and mice. And all of this data is collected by the National Teratological Society, and the data is extrapolated to a human based on the rat data. There obviously can be different situations where something might be appropriate for a rat-based animal, but actually if we extrapolate it over to a human, it could have potential more side effects to it. So it's a bit of a guessing game, really. There is obviously case reports and case studies of patients, pregnant mothers and breastfeeding mothers who have had medications in, for example, their first trimester, this dose for this duration, and this is what happened to them and their baby when they were born. So there are more and more information about drugs that can be used safely in these groups of patients. So if we just touch on some of the medications that I've already talked about in pregnancy. Loperamide is the first-line treatment for acute diarrhea and is considered to be completely safe to be used in pregnancy. Codeine can cause some fetal malformations. Metronidazole can cause some cancers. Ciprofloxacin is more of a theoretical risk to joints and bone, and coamoxiclav is considered to be quite safe. Now, it is really important that if you are in this situation and you are pregnant or thinking about becoming pregnant, that you discuss this with your doctors. Even if you're taking homeopathy, alternative medicines, acupuncture, again, there's a lot of information out there now about what is safe and appropriate for you to use. And it's always weighing up that risk versus benefit between managing the infection or managing the condition and making sure that the mother and the baby are safe. And every situation, every circumstance will be slightly different. Breastfeeding again, so loperamide is thought to be safe in the infant. Codeine is meant to make the baby quite drowsy, as it is, codeine itself is quite a drowsy drug, and if you are driving or operating machinery, to be aware of that. Metronidazole can cause some diarrhea and thrush in the infant, and ciprofloxacin is a theoretical risk of inflammation to the joints. Coamoxiclav is considered safe, but a bit of risk of diarrhea. But again, I would reiterate that if that does concern you and you are planning to breastfeed, discuss the options with your doctor and your pharmacist. And again, it will just be weighing up the risk and the benefit based on your individual case. So prescription charges. They're basically set about by the Department of Health, and a lot of people often ask, how do they decide how much to charge? Some drugs cost 2p, some drugs cost £2,000 per patient. So how does the Department of Health know how much to charge us for a drug? And it's basically a really complicated process, and they came out with around £8 is what we need to be charging per item. So that's recently gone up in April to £8.20. And there is obviously the prepayment scheme. So if you don't fall under the medical exemption criteria, which are listed on this slide, you therefore have to pay for your prescriptions. Now, obviously, if you have a permanent fistula or a permanent stoma, that means that you are exempt. A temporary one means that, unfortunately, you aren't exempt. And that list is being reviewed as well, as there's a lot of diseases and conditions that should be on, that aren't on. Now, in terms of prepayment certificates, so if you do end up having to pay for your prescriptions, it can turn out to be quite a costly process over the year and over the time. There are two different types of prepayment certificates that may be appropriate to you. There's a 3-month one, which basically means if you require 4 items in a 3-month period, you'll be cost saving. And a 12-month certificate, which if you require 14 items in the year, you will be cost saving as well. So it depends on, obviously, if you feel that you're in your condition is sort of in a deterioration at the moment, and you think that for the next 3 months you will require additional support, maybe antibiotics and other things, it might be best to get the 3-month prepayment certificate to tie you over. And these are available from community pharmacies and GP surgeries. Oh.
You can get them online as well.
Oh, and online, yes, got that one. So to conclude, we've gone through how loperamide codeine can help to manage your pouches, antibiotic treatments for pouchitis, probiotics for chronic pouchitis, their medications and side effects, and pregnancy and breastfeeding, and prescription charges. Does anyone have any questions for me? Thank you for listening.
Thank you. Can I just ask a question about prescriptions? There have been members of Red Line Group who managed to get exclusions, from paying for their prescriptions. It very much depends on the local area health authority and the doctor.
Yes, you're at.
Sorry.
No, go on, finish it.
Am I correct?
Yeah, unfortunately, we still kind of live in a bit of a postcode lottery. Some areas that you live in, like for example, Hertfordshire, they might give you treatment for exactly the same patient who lives in Brent, that would then be denied and refused that treatment or that cost. They are trying to standardise it as much as possible, but obviously at the moment they have their own budgets, they control their own budgets, so they decide what they want to put their money into. There is a lot of variation, you are absolutely right, but really good news that some of you have managed to get some prepayments or some money back.
It's definitely worth trying if you just had an operation or are thinking about, you need medication, it's definitely worth trying.
Yeah, absolutely. Yeah, speak to your GP, speak to your specialist doctors, see what they can do.
Okay, thanks.
Any other questions?
Thank you. Loperamide, you said there were significant differences between melts, tablets and capsules. Could you explain that?
It's more in the formulation of it. So our first line here in the trust would be to use the capsules. Obviously some of our patients also have stomas as well, so we can still open the capsules and use the powder, dissolve it in water and drink it. The tablets are then also usable, but some patients might find that they see the tablets coming out as well. Liquid we try and stay away from, reason being is because it has a lot of bulk sugars in it, like sorbitol, which basically increases your output further in quite an aggressive way. So we would prefer to use the capsule or the tablet. Then there is more and more growing evidence about the loperamide melts, which is like a dissolvable tablet on your tongue sort of thing. But again, all the data in the trials that we go against, that we use here in the trust, is based on loperamide capsules. So it's the longest standing evidence that we've got with the biggest number of patients that we've trialled. And the newer tablets and melts and everything else that are coming out are very small case reports with small numbers of people being involved in it. So it's not enough significant data for us to switch just yet. And obviously cost differences as well.